Good afternoon and welcome back to GP Video Podcast by Nadia. I couldn't make one yesterday because I was not very well, but as you know that a doctor and a mom is not allowed to be sick for more than one day. So I had to pick up myself and be back at work and be back at what I do. So I thought, why not to be back at what is my passion as well. Okay, so we were talking about, I think the last podcast that I did was about depression and dementia, how depression can lead to dementia at later age. And then my next podcast after this one will be on how depression should be treated while in a demented patient, and how important are antidepressants, and also wanted to talk about the myth that antidepressant in young age or middle adult age can cause dementia. It is a myth only. It is not true at all. Actually, the use of antidepressants for treating depression is necessary for preventing dementia at later age. But we'll talk all about it in the next podcast. In this podcast, I actually wanted to wrap up the topic that I had left open, which is Mounjaro versus Wegovy. Both of them are weight loss injections which are in the market at this stage. Both of them are private brands. Wegovy is semaglutide, which is also available in form of Ozempic, which is the PBS brand for type 2 diabetes. And Mounjaro's actual name is tirzepatide, which is actually another drug for both diabetes, type 2 diabetes mellitus, and weight loss. So I wanted to wrap up that topic and tell you which one is better in what. So Wegovy and Mounjaro, in terms of weight loss and glucose control or diabetes control, Mounjaro is superior because of the mechanism of action, basically. So the verdict is that Mounjaro likely causes more weight loss than Wegovy, and it also exerts better control of type 2 diabetes. Though if we look at the pricing at this stage, Mounjaro is more expensive than Wegovy. So we tend to write more Wegovy for people because it's more affordable. But there is another thing that makes Wegovy superior to Mounjaro, which is Wegovy has proven cardiovascular benefits. Another key difference to consider is that Wegovy has proven cardiovascular benefits. So if you have heart disease, your prescriber may prefer it to Mounjaro. In a clinical trial, Wegovy lowered the risk of major adverse cardiovascular events, MACE, by 20%. MACE is a term that includes heart attacks, strokes, or cardiovascular death. Based on this clinical trial, Wegovy helps lower the risk of MACE in people with heart disease and who are considered to be overweight or obese. So Mounjaro is not currently approved for any heart-related uses, but an ongoing clinical trial is evaluating it for MACE reduction in people with type 2 diabetes. This study is expected to be completed in October 2024. Based on mechanism of action, because Mounjaro is it has got two hormone mimicking property, then one hormone mimicking property for Wegovy. So it is also believed that Mounjaro should be as good as preventing cardiovascular risks as Wegovy is, but because it hasn't been proved yet, the studies haven't finished yet. So till this stage, we can say that Wegovy has proven cardiovascular benefits while Mounjaro is still being tested for it. But both of them are good for weight loss. Both of them are good for type 2 diabetes control. Mounjaro being marginally superior, we can say. But Wegovy has proven cardiovascular benefits as well. So cardiologists also put patients on Wegovy all the time who are obese, who are type 2 diabetic and all. So this actually wraps up because I was going very deep in the mechanism of action and everything, which was needed, I think, at that stage. But because it got a bit too heavy, so I just thought that I should just wrap it up. And then if needed, we will come back to these podcasts again, like this topic again. But at this stage, my point is that please, if you are overweight and type 2 diabetic, or if you're just overweight, please go for one of these injections. Mounjaro is there. Wegovy is there. Please opt for it. There are no serious side effects. the only side effects that you would encounter are nausea and vomiting, and you can always be given nausea wafers for it. So please do not think that you need to wait or anything. Talk to your prescriber today, get prescribed, start your weight loss journey, because as I say, today is the day. Do not wait about tomorrow. Do not Dr. Google stuff too much. Do not go into the depth. Your health is important. Obesity is a pandemic. Obesity, once you lose weight, you will actually see lots of improvement in so many symptoms of yours. Like if you have back pain, if you have joint pain, if you have insomnia, if you have sleep apnea, you will be, you will feel yourself as if you are on top of the world. Your mental health will also improve a lot. So please go for one of these injections, and I don't care if you go for Wegovy or Mounjaro. I just wanted to, because I wanted to talk more and more about obesity treatment. That's why I came up with this topic as well. But otherwise, any one of them, please go for them and be on them and see the difference. See you tomorrow.